Across Douglas County, from sea level to the 9,182-foot crest of Mount Thielsen, public safety depends on one critical connection: reliable communication. Behind every 911 call is a system working quietly to ensure first responders can communicate quickly, clearly, and without interruption. The Douglas County Emergency Radio Communications System, ERCS, serves as the vital link between the county's 911 Emergency Communications Dispatch Center and more than 55 local law enforcement, fire, and emergency medical service agencies countywide.
With the support of the Douglas County Commissioners and with funding from Congressional Directed Spending, from Oregon Emergency Management, and from state Homeland Security programs, we have been able to do significant overhaul to the emergency radio communication systems. The Douglas County Radio Department has completely overhauled our emergency radio communication systems, which has been critical for first responders and for Douglas County residents.
When the current commissioners, Tom Kress, Chris Boyce, and Tim Freeman, and radio and IT staff came on board, they inherited an aging, 30-year-old analog system made up of 19 relay transmitting towers that had become ineffective in providing adequate coverage for today's public safety communication. Commissioner Tom Kress led the charge and helped Douglas County apply for and ultimately receive a once-in-a-lifetime grant through FEMA's Hazard Mitigation Grant Program. This never-before-awarded funding opportunity is what has funded the critical digital modernization effort of our ERCS system, ensuring first responders can maintain communication when it matters most. This grant, however, came with a significant condition. The entire funding amount and project had to be expended within 9 months, or the county would not be reimbursed for any of our expenses. The compressed timeline led many industry professionals to believe the project was impossible to achieve. Despite these challenges, by utilizing performance-based contracting and with project management support, the trio of former Douglas County Emergency Manager Wayne Stinson, Commissioner Kress, and Director Laney successfully led the effort to completion, on time and within budget. In doing so, they effectively delivered in 9 months what many experts had predicted would take over 3 years. Upgrades included complete replacement of the VHF and UHF two-way radio communication systems, added secure encryption to the UHF system, interoperability that allows us to integrate with state and federal agencies, modernized microwave electronics at all 19 relay towers, replacement of backup power batteries, generator replacements, GPS timing component updates, and improvements to direct current power systems.
Communications is a critical component for providing public safety, not just during large emergencies, but on a daily basis. It is critical for police, fire rescue, EMS, and mobile crisis services. When seconds count, first responders need the ability to communicate quickly and without limits. I am thankful that the commissioners and our county radio division have prioritized this project and are making great strides in pursuing and completing a much-needed replacement to our current outdated radio system. This project will not only improve coverage, but also functionality. First responders will be able to communicate more effectively with partner agencies here locally, regionally, and throughout the state, which will improve incident response and safety for everyone involved when help is needed.
Your Douglas County government and the Douglas County Board of Commissioners have been working day in and day out to see through the upgrade of our emergency radio communication systems. Through this upgrade, we'll provide enhanced communication 24/7, as well as improved communication with our responding partners in the event of a large-scale emergency. The improvements to our emergency radio communication system help ensure the safety of all our Douglas County residents across the 100 valleys of the Umpqua.